Hi guys, welcome to Noni Seattle. So today we're going to talk about mental health. And Rosie wants to join. Say hi. Hi. So, oh. So today's topic going to be about mental health. If you're not familiar with what mental health is, today's topic and discussion is going to be a little bit heavy and difficult to listen to. So just want to give you a heads up. That's what we're going to talk about today. What is mental health and why are we talking about it now? Letting you guys know kalau mental health itu topik yang I really care about, and it's actually one of the reasons why I created this channel. Before we start, just a disclaimer that I'm not an expert, I'm not a psychologist, I'm not a therapist, I am just a human being who happens to know a little bit about mental health and is currently still facing a lot of mental health issues until today. Please take what I'm going to say today with a grain of salt. I'm just giving you this lecture based on my own experience. Jadi, apa sih mental health itu? What is mental health? Mental health is a person's condition regarding their psychological and emotional well-being. Jadi setelah dengar definisi barusan, kira-kira kalau diterjemahin ke Indo, mental health itu artinya kesehatan batin yang kita bisa ukur dari sikap, perasaan, emosi, dan suasana hati kita. Pertanyaannya sekarang, kenapa kalau misalnya kita ngomong mental health di Indo terutama, orang langsung mikirnya, oh kamu tuh gila. Kenapa mental health itu diasosiasikan dengan kata crazy atau gila? The reason why is because people are not familiar with what mental health is. It is something different. It's something that is not being taught in school. People don't know what mental health is. So when people don't know, ketika orang tuh nggak tahu, mereka lebih percaya sama stigma dan mereka lebih mendengarkan rumor-rumor di luar sana dari cari tahu sendiri artinya itu apa sih sebenarnya. Orang itu nggak gitu biasa dengan hal yang berbeda, jadi mereka itu wary, mereka rada cautious when it comes to something they're not familiar with, which hence mental health becomes a scary thing. Zaman sekarang kalau misalnya kita ngomongin mental health, banyak orang bakal bilang, ih kamu lebay banget sih, you're just overthinking, like what is mental health, you're just too sensitive. These are the common things that people would say and assume, and I'm here today to let you guys know that that is not okay, and I will tell you why. Percaya nggak kalau banyak banget orang di luar sana itu struggle sama mental health. There are more people out there who struggles with mental health than you know, and a lot of people keep this hush-hush and down the low because they're embarrassed to say it, because they don't wanna open up. This is why exactly mental health is a very important issue, because it happens to a lot of people, but not enough people out there are talking about it. I really think that more people out there need to acknowledge that mental health is a real issue and it's a serious issue and it is a sickness. Why is depression more taboo than cancer, let's say? Okay, why is it okay for cancer patients to seek for help in the hospital and seek for help from the doctors, while it's not okay for people who have depression to seek for therapy? Kenapa kita harus treat them the opposite way? Kalau misalnya orang bilang, oh saya lagi sakit flu, oh kasihan ya, ke dokter deh. Tapi kalau misalnya kita ngomong, oh saya lagi depresi, jawabannya, ih kamu lebay cuma overthinking aja. Kayak kenapa kita treat them very very differently, padahal dua-duanya ini sama-sama issue yang really serious, and people don't joke about it when they say that they have depression or they have anxiety or they have mental health issues. So the number of people who have mental health issues are increasing nowadays because of pandemic, because of social media, because of the news, and these are external factors lately that have been influencing people's emotional well-being. Tapi benernya banyak juga faktor-faktor yang lebih complicated yang menjadi alasan kenapa orang-orang ini punya mental health issues. It could be childhood trauma, it could be abuse, it could be bullying, it could be a lot of things that happened in their past that triggered and caused these mental health issues. If you're suddenly sad for no reason, you're not crazy, it's called depression. And if you suddenly feel like it's really hard to breathe, it's not crazy, it's called a panic attack. There's a name to each of these conditions that people are not familiar with. And I just want to let you know that these things are real. There is a diagnosis that therapists, licensed therapists, can give and provide to you. Kenapa?
I'm gonna put that in the video.
No. Okay, ooh, I feel better already. Just kidding. Here are a few examples of things that are actually not okay to tell people and can actually trigger their mental health. Number 1, and this is something that I still struggle with, apalagi sebagai orang Indo. Kamu gemuk kan ya? Kamu beratnya naik ya? Did you gain weight? You look fatter. I know kalau misalnya di Indo tuh emang kebiasaan orang kalau bisa ketemu orang udah lama nggak ketemu, banyak orang suka komentar bentuk badan, terus bentuk muka. Orang-orang bakal komentar tentang how we physically look. And sometimes it can be flattering and you can take it as a compliment, but then most of the times these things can actually trigger people's mental health. Imagine if your friend has been having an eating disorder dan kamu ngomong ke dia kalau kamu gemukan ya, dan dia padahal lagi starving herself or himself because he thinks or she thinks that they're too fat. You can trigger their mental health and make their eating disorder worse. I know these things seem harmless, but they're actually not. Again, if someone tells you, "Oh, you're so sensitive, we're only joking." If anyone has ever told you this, I just want to say I'm so sorry that you have to go through it. Kayak gak okay kalau orang ngomong kayak gitu ke kalian. Again, this is very important. I'm going to say it again. It's not okay for people to invalidate your feelings. Your feelings are valid. If you feel hurt by what they say, then your feelings are valid. Here's an analogy. Imagine kalau kalian tuh pernah jalan di jalanan A dan kalian kepleset. Begitu kalian di jalanan A lagi, pasti kalian bakal lebih hati-hati dan lebih jaga-jaga supaya kalian nggak jatuh. Mungkin banyak yang tanya, kamu kenapa sih hati-hati banget jalannya, cepetan dong. Kamu pasti bakal ngomong ke mereka, oh aku pernah jatuh di situ, makanya sekarang aku hati-hati. Dan mereka pasti jawabannya, oh gitu, I see. And this is the same thing when somebody asks you, oh, why are you so sensitive? Because I have been hurt in the past. Of course, I want to be cautious. Of course, I don't want to get hurt again. Of course, I want to make sure my feelings are respected. There is this word, gaslighting. If you've never heard of this word, then this is going to be a new vocab for you. Apa itu gaslighting? Gaslighting itu memanipulasi orang supaya mereka mikir kalau feeling mereka itu nggak valid dan feeling mereka itu lebay. Contoh gaslighting itu misalnya kalau kita dikatain sama teman, terus kita curhat ke teman yang lain dan bilang, oh tadi tuh si A ngatain aku sakit loh. Dan teman kamu B bakal bilang, dia kan cuma bercanda, kamu kebanyakan mikir aja lah. Another example is if you ever got bullied in the past and you tell your parents about it and your parents simply say, oh, your friends are only joking, they didn't push you on purpose. That is a form of gaslighting as well. A third example is by saying, kamu gak bersyukur ya, orang lain tuh lebih susah tau. This can also trigger people's mental health because you're invalidating their feelings and you're invalidating their experience. Jadi aku pengen share aja pengalaman aku dan semoga bisa raise awareness supaya kalian yang mungkin pernah dikatain hal-hal yang sama bisa sadar kalau oh benarnya hal itu nggak oke. Just because the person sitting next to you has a full body cast doesn't mean your wound hurts less. Gara-gara orang lain mengalami hal yang tanda kutip lebih susah, bukan berarti apa yang kita alamin sekarang itu gampang. Apa yang kita alamin sekarang itu tetap susah. Nggak oke kalau orang lain bilang ke kita, ih kamu harusnya bersyukur, kamu kan nggak sampai kecelakaan mobil. Yes, tapi luka yang sekarang kita punya itu tetap aja sakit dan tetap aja perlu disembuhin. Ada juga waktu-waktunya dimana kita mau ngebantu orang, tapi ngebantunya dengan cara yang salah. For example, if your friend is going through a lot of things in their life and you tell them, hey, I went through it too. Look, I'm fine now. You can do it too. Yes, it could be motivating in a way, tapi in another way, it feels like you're comparing yourself with your friend. It is very condescending because it seems like you're minimizing their problem. Ini seolah-olah kalian memandang dia rendah gitu. Kalian memandang, oh masalah kamu kecil kok. Dulu gue juga pernah kok ngalamin hal yang sama dan gue sekarang bisa get through it. That is not okay. Those are a few examples of the things that I've either personally experienced or I've observed people did to others. Now, I want to compare how mental health is being perceived in United States and Indonesia. Not a surprise kalau di US tuh lebih banyak orang yang aware soal mental health because they have more resources, they have more education about it, they've done a lot of research regarding mental health. Lebih banyak orang yang sadar mental health itu sebenarnya apa dan mereka punya waktu untuk mempelajarinya. Comparing resources and researches in Indo, banyak orang yang belum tahu apa itu kesehatan mental, apa itu mental health, dan mereka mengandalkan stigma kalau orang yang punya mental health itu cuman lebay atau cuman overthinking. By nature, us humans would of course want to protect our image. Kita pasti banyak orang yang suka jaim, suka mau jaga image. Jadi kita nggak pernah share problem-problem kita, masalah-masalah kita ke orang-orang. Karena itu lebih banyak juga orang yang benarnya punya mental health, jadi nggak pernah mencari bantuan yang mereka sebenarnya butuhkan. If you're hearing this and you can relate to some of the things that I mentioned, I just want to assure you that you are not crazy and you're not overthinking. What you're going through is painful, and I really hope you're surrounded by supportive friends and family who will stick with you till the end. If things are not looking up, I really hope that one day you have the opportunity to seek for professional help, seek for counseling, seek for the doctor who can help you heal and overcome your issues. So if there's anything that you take away from this video, is first, more people than you think have mental health issues. Emang ini topik yang jarang diomongin juga di antara orang-orang Indo, but again, I just want to raise awareness that this issue is real and more people should be talking about it. Also, breaking the stigma here that mental health is not a weakness. Kalau kalian punya mental health issues, kalau kalian struggle with mental health, kalian itu nggak lemah. Mental health is a condition. You don't choose to be depressed. You don't choose to be anxious. This is a condition that you have. Same thing kalau misalnya kalian lagi sakit, kayak if you have flu, you don't choose to have flu. You get flu. This is the condition that you have. It is a complicated issue though that a lot of people are still unaware of. But letting you know that there are outlets out there that can help you, that can provide a solution. And there are people out there who are willing to support you and help you go through it together. Big message that I want to put out there is that you are not alone. There are a lot of people out there who struggle with mental health, including myself. And I got better through therapy. I got better through the help of family and friends. And I really hope that things will look up for you too. If you know anyone who are struggling with mental health, I hope you don't cast them out. And nggak kecilin orang-orang yang justru berani curhat sama kalian tentang masalah mereka. So we're going to provide the Suicide Prevention Hotline in the description. I believe this number is available for people living in the US or international as well. Jadi, me and Sharon, we actually did research on the suicide prevention in Indo, and unfortunately, we couldn't really find a reliable one that we can actually trust. So we're going to put this international number in case you need it. So that's all for today's video. It's a little bit more personal today, and as always, I hope you learned something from it, or you enjoy it, or you can relate to it, and see you next time. Bye.